Next, before I welcome Dr. Anupama, I'd like to welcome our former ARC chairman, Dr. Chitra Ramamurthy, who is here with us. Welcome, ma'am. Next, Dr. Anupama Bappal will be speaking on innovative 3D printed B-scan working teaching model. Dr. Anupama, please.
Thank you, sir. A very good morning to all. So my journey in ocular ultrasound began as a postgraduate student and then as a retina fellow. It took a little while for me to kind of master the technique and interpretation of B-scan, but eventually as a teacher, it's my responsibility to teach my students the B-scan in a very simple way. So B-scan is a very essential investigative skill a postgraduate student should be able to perform. And the challenging part about B-scan is the ultrasound is invisible. So the student is unable to see where exactly the sound is falling in the eye. And at the same time, to convert the 2D image to a 3D imagination is a little challenging for students. So what we did was we replaced the invisible sound with the visible light waves, and we started it from scratch. So I took the tissue roll, I took this plate with a slit aperture which you would find in an Indian kitchen. So we put it together and we got this slit illumination. So all you need is a source of light, a tissue roll, and a slit aperture, and then you get the slit illumination here. So now to understand the different technique of B-scan, that longitudinal, how to hold the probe for a longitudinal transverse scan, and which part of the retina is being scanned during this technique becomes very easy to understand. So we wanted to refine the B-scan, so that is when, this prototype, so that is when we designed a 3D B-scan prototype, and this is what we got. So you can see this video which shows the positioning of the probe for a longitudinal scan. It's so beautiful to see that the student can also visualize the area of the retina being scanned for these longitudinal transfers and axial scans. So the learning becomes very simple. And the interesting feature of this B-scan prototype is now whatever is being scanned is also scanned is also captured on the screen. So hence the student also gets understand the concept of the area corresponding to the marker is seen superiorly on the screen. So when we took feedback from students, we got a very good feedback from students. It was quite encouraging. And when we assess the retention of technical skill, majority of the students could retain the technique of performing B-scan and interpretation of B-scan. So and B-scan should also be included in a simulation-based curriculum in ophthalmology. So I end by saying that this is a very effective model to teach fundamentals of B-scan, especially the technique of B-scan. It gives tactile experience to students, and teaching and learning becomes much, much simpler and easier. Thank you.
Thank you, Dr. Anupama. Judges, please.
Interesting idea, and I think when we use it, we'll really understand the practical, but from the students' feedback, it does seem to improve their...
So because in chapter and book would be about 4 to 5 pages, to read all of that and to kind of assimilate it and do it becomes a little difficult. It was difficult for me. So when I taught my students, I wanted them to learn it in a very simple way, and this they learn it in just 5 minutes.
So it does help in the orientation of the anatomy.
Yes.
But the interpretation into 3D is still a challenge.
Difficult. No, but at least they know that which part of the retina is being scanned, and it's easy for them to convert 2D image to a 3D imagination.
Yeah. Thank you.
Yeah, thank you, sir.